Hello, everybody. Hello. Hi. I want to do something real quick. It's a little silly. I just thought about it right now because I know how y'all feel. I've been here too. And I have my little lady. So I'm in dual mode right now, right? So I want to see how fast we can go around this room and just introduce ourselves. You could either stand up, throw your hand up, or just yell it out. Just your first name. Nothing else. No affiliation. We're all just here right now. I just want to know the names of folks that are in here, and hopefully it can kind of wake some of us up. I could see some people nodding. I'm not going to point you out, you know what I mean? Some drool hanging. All right, so I'm going to set it off. My name is Carlos. We're going to see how fast we could do this, and it doesn't matter. You know, just boom, throw your name up.
Alex, Brandon, Abby, Taylor, Trevor,
Don't be shy, y'all. Come on. I know some of us are a little too cool for this, but let's do it.
Nate, Marty, LJ, Vic, Derek, Michelle, Julia, Bill, Josh.
Beautiful. That's what I'm talking about. You see what I mean? Who hasn't gone? Who has? Yes, let's give ourselves a round of applause. What was the point of that? What was the point of that? The point of that was for us to just have a moment, chuckle, laugh, come together, which is really what we're going to be talking about. It's kind of my specialty, if you will. We're out here communicating with the folks that are in the community, and that's the premise of this work that we're going to be sharing with you all. Engagement. That was kind of a nice segue, right? Community engagement. I'm going to give it to you.
Okay, so I'm going to give like a really fast elevator pitch of what the Division of Community Care is, and I haven't quite committed it to memory as I have for the DART program over the years, but I feel that the journey of the Division of Community Care really came a couple years back out of a lot of trust and belief that us in the health department that became the Department of Health and Human Services could bring something forward that would have respect and autonomy within the landscape of public safety to complement what each other does, to help make everyone's role maybe just a little bit easier, and to create something that was new, because we knew what we were doing was not necessarily working and trying to repeat the same things that hadn't been successful in the past, or that there were so many constraints around regulation and policy that it was difficult to stand something new up. So what the DCC is it is we're trying to get away from the word alternative, so I even just paused myself there, but it's an option to offer people within the spectrum of emergency services that is deemed to be appropriate, meaning there is not a weapon involved, that someone has not caused another person harm, there's no enforcement action that's required, there isn't an element that involves a medical need that should be triaged and assessed by a clinical staff like EMS or fire. There isn't a restriction that is in or putting out of compliance regulation or policy and law on the books that could offer an alternative response within the landscape. I said alternative again. See, it's almost impossible not to say. To get a resource out into the community to de-escalate, address an urgent emergency-like need, and create a different opportunity for a pathway that might not involve the emergency department, might not involve arrest, or might not involve another potential conflict, especially out in shared space or public space areas. So the DCC was born out of this desire to put a new opportunity within the system of care for people to self-request and then also to be embedded within the 911 system. It's been 2 years in the making since we were put to task to start to develop this, and I could tell you that I had every intention of trying to bring it into life as fast and as reasonable as possible. But I think that you could probably spend 10 years building something like this and still not know everything that you should and need to know. But I do know that we had the best city that I believe in the country was for collaboration, trust to be earned and learned, and then also a lot of the systems that we already understood that were taxed and burdensome, great people behind them wanting to do the right thing and supporting our communities. So it's been baby steps and then a lot of rush and hurry up and catch up, but at this point we have launched. The DCC has been brought to life. Yes, it was September 5th of last year. And we did things in phases so that we could make sure we were good at what we did and that we didn't overpromise and we also didn't overstep. And in those promises, we looked to try and make sure that we could meet the needs of what someone may come and believe that we could help them with. And we've done that. And we've had some really good milestone outcome experiences to, again, stop, pause, look, listen, and change and adapt as we needed to. So we're on a second round of hiring, and I'm not going to talk too much around in detail, but I can tell you that there was not a moment in this process that I did not take and draw and grab from all of the incredible experiences I've had the opportunity to learn with all of our law enforcement partners in this room and all of our treatment providers in this room and all of our behavioral health providers and all of those that work behind the walls, and then our funders and our justice partners and our advocates and all of the systems of care that made DART this crazy amazing thing that we were able to learn from and put into practice for this DCC. The community responders are a manifestation of all of those best qualities that I'm really excited about bringing that to DART now as DART has taught it. So I'll leave it at that, and I'm looking forward to this team giving you a little bit of a tour of what the Division of Community Care is and what you'll be able to offer through your DART programs.
All right. Hi, I'm Kristen. I am the director of the DCC. I came on about 1 year ago, and I just wanted to give a little bit of information on my background. So when I came over to Northampton, I had been primarily working in the adult disability field for the last 20 years, developing and programming for different organizations from youth to adults, really thinking about specialized populations within the disability field. So I did a lot of work in the brain injury field. I did a lot of work with children with social, emotional, and behavioral situations where we were developing recreational programs to help meet their needs so they could be more successful, whether in school or at home. And then I also went into the school systems for a while, and I was a school administrator for a number of years, again, developing programs around helping students with their social emotional learning and creating alternative programs within schools to help them be able to access their academics and be in public school systems instead of needing to switch over into specialized schools. So after that, I briefly worked for DCR doing therapeutic recreation and working for the Universal Access Program, providing adaptive recreation in state parks before I came over to Northampton to start implementing this program. So we are going to talk a little bit about the logistics of the DCC to start. We have multiple ways to access our programming. And our programming we're going to go into in a little bit, which includes a mobile response and a community space. But in order for folks to access it, was really important to us to think about eliminating barriers and creating the most amount of methods for people to access us. So folks can text us, they can call us, they can email us, they can walk in to access our services. They can call for themselves, they can call on behalf of someone else, and we will reach out and see what supports we can provide. And the other piece is that we serve all residents of Northampton and their visitors. So if anyone wants to utilize our services, they can come to us at the community space. They can give us a phone call. But we're not just supporting one population, even though there are certain populations that we do see more frequently. We're really here to support anyone who reaches out to us. And we have had folks from other towns come in or be driven to our site where we can provide supports for them as well. So as Michelle said, we opened our doors on September 5th. And since that day, we have had 1,393 contacts, and we've served 438 individuals, unique individuals. So what we're seeing with those numbers is that we have a lot of folks who keep coming back to see us, and we're building relationships with them. And one interesting thing is when we were starting out and planning and developing a training for our community responders this past summer, we were really thinking we would primarily be doing mobile responses. That's what we had in our mind, and that's what we were training for and anticipating. And that's not what we saw. When our doors opened, we had people there ready to come in, and we have community members coming in high numbers every day to connect with us and to utilize our services. And so what we had to do at that point was kind of stop and think and shift how we were doing the work and what we were providing. We really thought we would have more teams of mobile teams going out and just a couple people back at the community space, and we had to shift based on what the community was asking us to do. When we made the decision to kind of set up our teams as more of a mobile response, we were doing that over a number of things, but one of the things were the listening sessions we had and the key informant interviews that we heard about earlier today. But really what it has come down to is the folks we're serving and what they're asking for. And so that's really what we try to do is we're planning and developing our program as we're looking at the immediate asks and also what the community sees as potential needs, so we can develop programming and do outreach and engagement to try to target those individuals that the community is bringing to us for areas of additional concern that may not be presenting to us themselves. So when we started, we really wanted to take a slow approach, as Michelle mentioned. We were really careful to make sure that when we were opening our doors, we weren't taking on too much too fast, and we really wanted to kind of hone in on looking at the needs and getting really good at what we're doing. And what we saw is that we had people coming in, and the ones that weren't just coming in to gain information or to get resources and kind of move on to that resource were folks who had a really difficult time accessing resources in the past. Or they might have utilized the resource and they said that it's not for them anymore, or they came in and they didn't even have something that they wanted to talk to us about. And so our community space, when you walk into it, almost could look like a drop-in center, and that's not what we are. We are set up as a living room model. We have couches, we have snacks, we have food, but the purpose of that space, based on what we were seeing in the folks that were coming back day after day, was to set up a space where people are feeling comfortable and connected, where we can build relationships with folks, so then they're able to get to the point where they are able to tell us what they're looking for or what they need. And a lot of the folks that we're serving have a history of trauma, and we know that it can be really difficult when people are coming in and they're in that escalated moment or that frustrated moment to be able to do the steps that need to be done in order to reach their next goal or what they're looking for. And so our hope in creating this space where people are feeling comfortable and connected is to get them in the mindset where they can do the hard work when they're ready to do it, and that they already have that relationship or that person to do that work with, which is one of the community responders. And so when you look at our space, it was done very, very intentionally to be a space not just that folks can come in when they're having a difficult moment, to be able to feel calm and safe and have some privacy, have some support, but also be a space that feels like theirs, so they can feel really connected and get into that mindset where the hard work is easier to do when they're with us.
So as Kristen mentioned, my name is Carlos again. We have a mobile response team, and so whenever there's a call, this is the first opportunity, and pardon my voice because I'm dealing with like bronchital type stuff, but we are able to assess a situation in reference to what the situation may need, right? So we're not enforcing anything. For instance, if we're called because of an encampment, or if we're called because somebody's in town, kind of like, talking in the middle of the road or maybe screaming at folks, we're able to pull up and be present with them. We're not pulling up as if we are pulling out, a toolbox to kind of resolve this situation. Our goal is to, see what it is that we're capable of doing for that person. And if it becomes a violent situation, or if there's a weapon that's brandished, or if it's something that's kind of out of our control in reference to somebody getting harmed, then that's when we can take it to the next level. We can call back, and then we have a process where then we can call the EMTs or, the police department. But for the most part, our job is to assess just what's going on and see what the climate is and where the person is at. And based on the training that we had prior to, to responding, we're not pulling up with the mentality of the answer, finding out the answer. It's really what aid is this person in need of at that moment. And sometimes that seems logical, but when somebody's got, piss and shit on them and they're just kind of talking in the air, folks don't necessarily want to look past that, right? It's hard for somebody to just be there and just be able to be present with that person, to understand that this person may be going through something, as opposed to, their outer appearance and so forth. Next one. So the way community engagement looks, for me, it's really the best part of this job, right? We're not even, we're 6 months. And, it's the ability to be outside without having to worry about time within the parameters of our time, right? But, not having to hurry up and, get the situation finished, being able to walk with somebody for like an hour. As a matter of fact, outside of this building, I had one of my cases that, we got a call to check in on, and I was just coming to work, dropping my daughter off, and I saw the person, and they were right across the street, and I just pulled over. I made a phone call, said, listen, I see the person. And I was able to just literally right across the street sit down with them, and they were in really tough shape, tough shape, houseless person. Folks in the area know who they are, and that stigma alone is like, okay, it's this person again, right? It's this person again. So that particular morning, I was able to sit down with this person, just listen, because this person was in a very, I hate the word manic, but in reference to the dialogue, it was just nonstop, But I was flowing with it, and I was just present. And I was able to get this person into the DCC to get some coffee. I said, hey, let's go, would you, let's go grab a cup of coffee. And, and the person came with me, which was a big deal. Because a couple of the times when I had seen this person, this person's always walking really fast, And so if you see him, my goal is I got to find this person and try to engage with them. I can't just say, hey, I need to have a conversation with you. So it's strategically just kind of like trying to place myself in a way where this person can see me and not come off as a person who is trying to get something from this individual. And I mean, we all have our ways of doing things, right? And in reference to engagement, or even just the way we communicate with somebody like at the supermarket when you're waiting in line and you just have a quick conversation, very nonchalant, right? And that is the goal. It's just how do we get into a space where they can kind of see us. And with this particular individual, I tried twice prior to this particular day, and they weren't stopping for me. As a matter of fact, as soon as I pulled up, they turned the other way. And I was able to kind of go with them and just exchange a few words, and then I just fell back and I let it go. So I was surprised that this particular day, that person was willing to sit with me. Now again, this person was in rough shape. 4 pair of pants, drooling, could have been off medication, could have been a number of things, but it wasn't a good situation, right? This is not even 8:30 in the morning. And so to get him back, bring him back to the spot, have some coffee, and then we were able to I took a drive with this person. I actually just drove. We went up north somewhere and just kind of I pay attention to all these little things, like the person putting their seatbelt on, right? Enough, because they were still smoking a cigarette, putting it in this coffee, drinking a coffee. There were a lot of things that I was paying attention to that I was noticing, but there was also the importance of what the person did in reference to something as simple as put their seatbelt on, right? So I got to spend time with this person, and that led to this person and myself developing a relationship and getting this person to a place where they are truly wanting to be inside now and doing everything possible, seeing the doctor, like following up on, it's kind of like night and day, and hearing the backdrop stories of the things that this person has been through that was said about this person, right? So if somebody's saying, this person over here doing all these things, to be in a relationship with them where they can then say, yeah, I know, when I get like this or when I get like that, I tend to do these things. And so my position is, what can I do when you're in that situation? What is it that you would need so that you can feel, even if you're having a breakdown or you're having a reaction to something, how can I be supportive if I were to pull up and see you in front of, one of these stores or something like that? What is it that you would need? And that is the beauty of what it is that I feel like we're doing. We're outreach workers, right? And then once we get them in and we develop that relationship, then we can connect them with the resources that are available, as we've been hearing throughout this whole day. The folks that are experts in their own field, not trying to duplicate or replicate what's already out there, but going through that process with them. Mimi, next one. So when we start thinking about the philosophy, it's hard for me to say. At first, I wanted to say, how do we teach the spirit, really? And I didn't want people to freak out, right? Like thinking I would get all esoteric or something. But yeah, we can talk about the philosophy in reference to just the ideals, the goals, but there is something special about being able to connect with people out there in the street. I'm a 9th grade dropout. I have a million stories, okay? I didn't go back to school until I was 23, only because I was gonna get locked up. That's just my reality. So from 13 to 23, I learned the world in a different way. And that world was dark, and it was out in the street. And you had to pay attention to language and the way people moved and the way they looked at you. And one minute they could be cool with you, the next minute they're robbing you. I was 13 the first time I got kicked out, and that became a repetitive process for me. But I wasn't alone. There was a whole generation of us. So when I was out in the street, there was a whole bunch of us out in the street. I fought all the time. I lost, I won, but I never ran. But it was frightening. It was terrifying. Like, what was I going to be doing? What was I supposed to do? So my mentality was never to succeed. It was just to get through the day, get through the next day. My mother, who I loved, dearly, passed away when she was 35 from alcoholism. And I came up in the heroin era. I'm 54, just for context. So everybody was doing that. But it was this communal thing. They were still functioning, but it was still happening, right? And so I saw all of this stuff. And as I got older, the irony was that I was also hanging with the people that were selling. So it was just this really screwed up reality for me. There was no real middle ground, And, once I got an opportunity to change my life, I had no idea that I would be doing this type of work. But I still wanted to tell these stories, So I studied film and video. And then I got into teaching. I got into working with the young folks that were messing up, that were on their way dropping out. And that was my lane. That's what I love to do, especially with the young men of color, who feel like nobody cares. They don't talk about love, self-love, and I love being in those spaces. I love being able to look at these young folks, especially young men, and say, I love you, man, without the no homo thing after that. No, I'm serious, right? I could pull up into a spot and be like, yo, I love you, man. Because we're not used to hearing that. So once I get past that, then I'm starting to hear all these stories about like what landed them where they were, why they dropped out or how they became a young parent. I'm sorry if I'm messing with the mic thing. So when we think about the philosophy of the DCC, it's really to treat, it's coming from the most basic principle on a very human level. It's not to replicate the services that are already around, that are happening. In fact, just like Michelle was saying earlier, it's really about integrating into these systems that are already in place. Like none of us want to wake up and want to be an asshole, right? Nobody wakes up and wants to be an addict. Nobody wakes up and wants to harm people. Like these things happen, right? Because of circumstances or whatever the case is that have gone on in their lives. But when you have a person being able to be present and not make a person feel like they're being judged, and it's not easy. It's not easy on a person doing that because you're holding someone else's emotion. One of our newest members put me onto a beautiful understanding of thinking about emotional capacity. Because I've been ingrained in it for so long that there are times when I don't even think about my own capacity. Like I'm not always taking care of myself, right? Because I'm in it. And that opportunity, that ability to do that is really the core of what it is that we're doing. And then there's the logistics. You know, like we're not trying to take care of things that are way out of our realm. You know, especially if there's something extremely violent happening in the moment, you know, and we're able to see past a lot of the things that could become barriers. Yeah, did you want to say something to that?
Yep,
Yeah.
I'm just going to add in a little bit. And so I think, you know, you touched on it, Carlos, but I think, you know, one of the main pieces of our work is to put aside any behavior that we're seeing. So whatever brought the folks to us, whether it's a follow-up from an engagement that already happened, or whether it's a phone call we got on behalf of them from someone else, no matter what the actual behavior that is occurring is, that is put to the side when we're engaging with them. As long as they're an appropriate person to be working with us, as far as we don't need to bring it to the next level of care, and it fits within the realm of the work we're doing in that moment. We're just thinking about what is the immediate need and what can we do to resolve that, and what are the underlying needs, and how can we get there to learn about those and learn about the person so we can give the correct resources to them to help meet those underlying needs. And so when we are having someone come to us with information, or we're, you know, even if dispatch is calling us with a situation, we need to know about the situation so we can respond correctly to that situation. But really, we're going in with the same mindset every single time. And the behavior that's occurring, whether it is substance use or it's conflict or it's escalation, that is what we put to the side when we're really thinking about what is the need, what is there that's not being met, and how can we help that person have what they need right now. And what can we do in this interaction to make them want to come back and continue building a relationship with us so we can be there to support them. And when we have folks that we know are high frequent utilizers of the 911 system, which is one of the people that Carlos was talking about, and numerous others, what we try to do is get there earlier in the day to spend some time with them and have a connection with them for a chunk of time earlier in the day so they don't get to that point of escalation where someone walking by might be calling them. So we really kind of plan that into our day and build that relationship, again, for two reasons. One, for that immediate need, trying to keep them from getting the person walking by calling 911 on them. But also so that we can get to know them better, so that with the hope of in the future, they're not in that situation anymore, and we've helped identify the resources that are missing in their life, that are causing the stress on them to make that behavior reoccur time after time.
Another thing I wanted to mention is once we get a person to a level, right? Not so much the next level, but we get a person, we get them inside, we get the paperwork going, then we can follow up with them. If the person is going to detox, we can bring them to detox. Person's leaving detox, we can be there to pick the person up. So it's an ongoing relationship. Even when we connect them with other social services, we can still be there with them. And that, to me, I think is kind of what makes it a little more unique, but not so different that it's not something someone else isn't doing or some other social service isn't offering, right?
Yep. And I think the other important part with that is that because we're not the people who are providing that resource, we're really just connecting to that resource and doing that handoff, but continuing the relationship. Oftentimes folks might discontinue utilizing a resource, and that's what we see. So, they get engaged, things are going well, they're utilizing the resource, things kind of stabilize. And often in social services, we won't hear things again until they've reached that crisis level. and they're back kind of where they were, and we have to rebuild. And our hope in continuing that relationship, like Carlos was talking about, and remaining engaged, is that it's right away we hear, oh no, I'm not using that anymore, I don't want to go there anymore, or that didn't work out. And so we can say, okay, well, here are some other things. What are you looking for now before they reach that crisis level again? So these are some of the top services that we're currently providing in our first 6 months that we're seeing people come in and asking for. So housing is huge, whether it is immediate emergency housing. Our shelters are often full. When we're looking for placing someone in shelters, we all obviously try to be local, but most of the time we end up going to Springfield to find immediate shelter situations for folks in this area. And then also folks looking for, longer term housing options. So we've partnered with organizations who do, temporary shelter situations, and we've also been trying to work closely with folks who help apply for long-term housing. We're doing some of that in-house now just because it's really hard. Like, housing navigators are really busy. Folks are often, it's hard to get people to go to an appointment and to make the appointment. So we're doing a lot of the application process in-house when we need to, but we're also making sure that we know of the resources that are available for folks to do it elsewhere too. Shared space concerns. Shared public space concerns. So these are often the calls that come in on behalf of someone else. If someone is in a public space and someone who is also in that space is feeling uncomfortable or doesn't think that someone belongs in that space, then we can go out and kind of navigate that situation with them. So whether it's a business owner calling because someone is at their business who's asked to leave and they haven't left, or someone on the sidewalk, we'll work with folks. Also, encampments are another place where we go with shared space concerns. Wellness checks. We have been asked to do some wellness checks. Again, it can be for someone who's outdoors and they are someone's just concerned. It could be a really hot day, a really cold day, someone who hasn't moved in a while, and they just want to make sure that they're okay, that they're just sleeping and they don't need anything. So we check on that situation. Or it can be, someone just hasn't seen in a while. We get some, really interesting calls from folks who, if someone's house sitting for someone else and they haven't heard from their house sitter and they want to make sure that the house sitter's still there. So we've had, a variation of these wellness checks. Conflict resolution is more when we happen upon it in the community. So when we're out and doing community engagements or we're doing events and there is a conflict that is starting to arise, then we're able to come in and try to navigate that situation a little bit and de-escalate the situation before things escalate. We've also done a lot of conversations around conflict resolution where one person has come to us to talk about a situation that they're involved in and they want support or to talk something through. And we've been able to help with those situations. Our resource navigation is what we do most. So every situation that we are working in, the goal in the end is to help them navigate to a resource. And so we have a community responder resource person who really specializes in understanding all of the resources out there, and part of our work is not just knowing what's there, but knowing how that work is done at that particular agency, what their current capacity is, what their intakes look like. We really want to have a true understanding so that when we're helping to match someone to that resource, we know the individual really well that we're matching them to. We know the resource really well where we're trying to match them to, and we can help them be successful in accessing that resource. And sometimes that can just look like setting them up with an appointment or going to that appointment with them, but other times it takes a little bit more, especially for those who are coming to our space who have tried to use a lot of the resources and been unsuccessful in the past. And in that situation, we talk to the folks who are doing the intake and we let them know what that person might need to be successful in their intake. And that might be different from what they traditionally do. So if we know someone can't sit for 20 minutes and answer questions, we're going to kind of give a heads up to the person that we're bringing in, see if there's any modifications or accommodations that can be made to help that person be successful in that process and to be able to access that resource successfully. So the other services provided, I'm going to speed up because I just got my 5-minute mark sign. Substance and overdose risk and harm reduction and safety planning.
All right, we're gonna just express thing. Go ahead, you got it. Partnerships. next thing we've been working on is strengthening the partnerships, communicating with the local folks that are here, trying to get these meetings set up once a month so that we could start a dialogue within this area with, working with Tapestry, NRC, Mana. These are the folks that are rocking with us: Natea, Donovan, Dylan, Melody, Anna, myself, next, Milani. Yep. Brandon, Gabriel, Alex, LJ. Next slide, Milani. Right. Boom.
And I know we're rushing, but I do want them to stand up. So,
Okay.
yeah.
To the next slide. Yeah. So that's some of our, yeah. So this is, if we go, yep. So this, so the way we've, the first cohort had a 3-month training, very intense training where we were trained through Wildflower, growing a new heart. We talked about hearing voices, dealing with, issues around suicide, language. It was a really, really intense 3 months. The second cohort got a little more of a condensed version of that. But a lot of the work focused on the way we are present, how we're listening, how we're able to disconnect, and more importantly, how we can kind of remove ourselves from the situation so that, again, we don't get caught up in trying to do too much, but also take care of ourselves in the interim. For instance, a DV situation, I'm a single dad, as you all can see right now, and we had a DV situation, but both folks need to get served, right? So, for me, that was a hard moment where I was able to pull Kristen to the side and said, I don't think I could do this right now with this situation, But I understood the importance of both people getting the services that they needed. If you all understand what I'm saying. I'm trying to be a little vague because, she's also pretty smart. That's a way for me to be able to check myself. It didn't mean that I wasn't ready to work with that individual. His partner, she was being attended to. We had folks, but I had a connection with him. I had a connection with him already. And so when the situation escalated and it became what it was, where she was in the hospital, it was hard for me to get past that. But I was also able to get past it later on, but in the moment be able to, kind of remove myself. So that's what I'm talking about when we are thinking about self-care and taking care of ourselves. And so we go through these trainings, it's more classroom training, and then we do what's called field training, where we're actually out there starting to develop the relationships, working on the partnerships with the business owners as well, homeowners. I mean, we're not really only dealing with just the houseless and folks that are dealing with substance abuse, but we're dealing with folks that are just kind of getting out of doing a little bit of time on 66 or just new to the area and just needing navigation based on resources. Mimi. So these are the new DART responders, which yes, I don't know if they're here or not, but this is also our newer initiatives. So again, as we're evolving, this is the kind of the next major integration, which is exciting.
Yeah, so I just want to say one thing. We kind of went over Kathy did a great summary this morning about the DART responders, and I think that, the piece that's really exciting about having community responders doing this work is that even though they will have this level of expertise, which is really a huge benefit for the DCC in general, they're also going to have that holistic knowledge and training on looking for all the possibilities that we can provide support to folks. So again, even if they're going out there and if someone's not ready to engage in that component of the work, they also can let them know of all the other services DCC has available. So maybe they want to discuss something around housing or food or mental health, and there's other parts that we can bring in to support in addition to the work that the DART program has already been doing. So the other piece is we do have that community space, so even if someone isn't ready to or wanting to engage there, we can offer that, and maybe they'll want to walk into our community space in the upcoming days and weeks and engage. We'll have a DART responder there, but we'll also have community responders there to help with resource navigation and support.
Nice. Well,
And
thank
then
you.
how to utilize the DCC.
Yeah, how do we utilize it, Milani?
So, like I said, we are supporting the community space at the DCC. So, is supporting Northampton community members and their visitors. So, if you have folks that you're working with that you think could benefit from our services, you can always refer to us through our phone number up there, the 877-322-0413, and we can have a community responder call and engage, or a regional DART responder go out to visit. And they're also welcome to come to us. So I know transportation can be a concern for some folks, which is why, calling us and having us arrange for a visit or a phone call or whatever they need might work for most people. But if you're working with someone and they're just looking for help or support with resource navigation, they're welcome to walk in to our space at any time. And the DART line phone number is out there. I'm sure many of you are familiar with it, but you're also welcome to use that line to get to us as well.
Okay. Thank you, Milani.
Today's been a jam-packed day. It has had a lot of information. We've gotten through some things very quickly, including even the DCC this afternoon. And I think what's most important to put this all together is essentially we have an expansion on what was the existing framework for the amazing peer work that was happening through DART, pre-COVID, during COVID. We're now going to be expanding on that through the opportunity of putting community responders out in the field, as well as having the DCC space itself as an opportunity to navigate people to. And a lot of folks might be familiar with what was the living room model, which was a very frequently used organizational framework for police to have as a drop-off location. And in some ways, some parts of the DCC community space was designed with that in mind as a very low barrier, low threshold opportunity as an alternative from the emergency department or in some cases where there is no emergency housing available. The value, I think, in getting to wrap up the DCC integration with DART is that we really hope both programs can be leveraged to complement each other and the various different skills and experiences we all bring to the table. There's a lot of great minds that are part of this program, and there should be no single one or two or three that are driving this ship. This is a very interactive and dynamic program, and it takes hearing your voices and your engagement and your feedback, is good, bad, and complicated as it might be in your unique community landscapes, for us to get better. And that's something I've really missed, is making sure that you hear from us, you see us, and we get out and we spend time and visit you. So as part of the follow-up from this training, Kathy and the various different team members in prevention are going to be coming out, and they're going to be speaking and meeting with people. And during those times, please do not hold back on giving your feedback from what was omitted, maybe unintentionally or should have been included today, as well as any pieces of the work that we're hoping we can also continue to meet the needs of your unique community landscape.